Types of embalming. All instruments should be sterilized to prevent a cross infection from body to body, can be a source of infection to embalmer also. The embalmer should always wear an impervious apron, skull cap, mask, and gloves as a caution agent against formalin reaction. Embalmers eczema. Embalming can be classified into two ways according to the method used. Arterial embalming, capillary embalming. Embalming fluid is injected through arteries. Embalming fluid is forced through arteries, so it reaches the capillaries. From this diffuse out into the tissue. Preliminaries. Place the body on a table. Remove clothing or surgical dressing if any. Wash body with the antiseptic soap and warm water. Break rigor mortis if present by bending, massaging, rotating the head. Face apply massage cream to face, ears, nostril, lips, etc. to protect these areas from dehydration or distortion, which can result from contact with the solution in the next step. Composition of the massage cream. Castor oil 2 part, Vaseline 3 part, hard paraffin 5 part. Nostrils and oral cavity for arterial solution into this cavity. Well back into the throat with the head thrown back. Clean and plug nostrils with a wad of cotton soaked in arterial solution. Fill out cheek with the cotton soaked in the solution. Pack neatly into the vestibule of the mouth. Close mouth otherwise dropped. Lower jaw will get fixed in a gap. If it proves difficult, use following method. Strong ligature is passed between the upper and lower incisor. Ends are tied together, putting the jaw in a position. Sutures are passed through the lip muscles from within the vestibule of the mouth. Free ends are knotted together with the jaw closed. If lower lip shows signs of decomposition, pass one end of the suture around the mandible in the midline and other end through the upper lip muscle and ligated with the jaws throughout together. Use a needle injector to push a grooved needle into the upper and lower jaw from within the oral cavity. The two needles are tied together with a wire closing the gap. If dentures are present, make a cotton block with a thread slipped through. Place it inside the mouth. Adjust dentures closed mouth. Cotton block would swell up with the fluid and retain denture in position. Slip out thread from the cotton block. In endentulous case, use a mouth former. It is a curved quadrilateral strip which fits inside the vestibule of the mouth and gives a proper shape to the closed mouth. Closed eyelid. If eyeball is sunk, inject arterial solution into the orbit. Head elevate 8 to 10 cm. Place on a headrest. Feet raised to facilitate drainage. Anal orifice vagina plugged with the cotton. Wood soaked in a cavity fluid. Okay. Then choice of vessels. Near the vessels to the heart. Vessels to the heart. Better result, especially for drainage. Most common artery is a common carotid artery. Maxillary, femoral. Generally, the predisposing vein is used for drainage. Smaller vessel, although sometimes used for as a secondary injection sites, are not normally selected as injection point because of their lesser size and strength. The desired arteries and veins are exposed and raised to the surface. Vessels are cannulate with the suitable tube. Injection and drainage point. 1 point injection. Injection and drainage from one location only, that is from axillary artery. Often leaves patches of areas unfixed by the embalming fluid. Split injection. Injection from one side and drain from a separate site. That is multi-point injection. Utilize 2 or more injection sites. 6-point injection. The variant of multi-point injection in which 6 areas of bodies are injected separately, right and left, common carotid, axillary and femoral artery. Useful in traumatic death, postmortem mutilation, autopsy cases. because multiple points ensure that at least untraumatized area with undamaged vessel receiving embalming fluid. Equal amount of fluid should be injected on corresponding injection sites to avoid distortion of the faces. Cavitary embalming. Used as a supplement to arterial embalming as a sole method when the body has been badly mutilated after postmortem time after 1 hour of AE. That is arterial embalming to follow for hardening of viscera if facilitate piercing the gut. Procedure done in two ways. That is closed cavity. Non-incisions are made. Entire procedure is done blind. The embalmer makes a small incision about 5 to 6 centimeter above the umbilicus and push the trochanter about 30 centimeter long. The trochanter is first directed upward, backward, and to the left to pierce aspirate the stomach. Then it is slightly withdrawn and pushed up towards the right to pierce the right side of the heart. Next, right and left pleural sacs are penetrated and aspirated. Then several punctures are made in the intestine, cecum, and colon to suck out content. Next, urinary bladder, sigmoidoclonum, and rectum are aspirated. 1 liter of cavity fluid is injected, distributing in evenly throughout the cavities. The incisions are either closed with a sutures or a trocar button is screwed in a place. Next is open cavity treatment. Later must specifically be explained about the details of the procedure. A median incision is made on the anterior abdominal wall above the umbilicus to the support process. After the procedure, incision is sutured. The cranial cavity contents need to be embalmed too. It is approached through the roof of the nose, chipping the cribriform plate, brain aspirated, about 100 ml of cavity fluid injected, nose plugged. Advantages. Access to organ is easier. Cavity fluid soaked gauze may be spread over viscera for additional preservation. Embalming powder can be used. Disadvantage is mutilating incision has to be made. Okay. Next is supplementary method of embalming. Hypodermic embalming. Used after defective artery embalming when some areas are not perfused properly. Embalming chemicals are injected directly into the tissues with a hypodermic needle. Surface embalming. It's used in cases of damage from accident, decomposition, cancerous growth, or skin donation. Embalming fluid is applied directly on the skin surface whenever required. Next is according to aim, anatomical embalming and funeral embalming. Anatomical embalming used for anatomical resection, sanitary consideration are greater than the cosmetic consideration. No venous drainage is required, orifices are not plugged, nor the jaw closed, sunken tissues are not rebuilt. Purging from orifices is not a major consideration. Cavitary embalming is not done except to infiltrate cranial cavity preserved. Funeral embalming used to preserve body if funeral is delayed because of any reason. Late is arriving late from the following countries, body to be transported far away. Cosmetic consideration are greater than sanitary consideration. Greater care is taken to prevent dehydration, discoloration, distortion of the exposed blood. Venous drainage is very essential to prevent distension. At least 3/5 of the total blood volume is drained. Purging from any orifice should be seriously avoided. Cavitary embalming is done as a routine. Next is apparatus. That is bulb syringe. It is similar to hinges and syringe, a type of manual pump. Construction consists of a bulb type rubber syringe and a rubber tube at either end. Valves within the bulb allow suction on one end and ejection on the other end when bulb is squeezed. Procedure. Injection needle is attached to the injection end which is introduced into the body. Suction and dip into the fluid container. Bulb is squeezed to inject fluid. Then gravitary injector. Okay, gravitary injector. The construction of a gravitary bottle per colata Each holder has fixed 10 liter of fluid, rubber tubing, or transparent plastic tube attached to its mouth with a clamp to control the rate of flow. Needle attached to the other end of the tube. Procedure: bottle is filled with arterial fluid, raised above the body by a pulley tackle and fixed at a height. A rise of 1 meter. Fluid pressure is equal to fluid pressure of 0.6 kg per square centimeter. To achieve a pressure of 2 kg per square centimeter, bottle should be raised a little above 3 millimeter. Advantage: simplest and safest method. Disadvantage: slowest method. Distribution of fluid uneven. Some areas remain untouched by fluid. Motorized injector usually inject the embalming fluid at a pressure of 2 kg per square centimeter. Fluid driven by motor which uses air for pressure pushing fluid can inject 10 liter solution in the vascular system as 10 till minute. Others: foot pump and stirrup pump. Thank you.